Good day, good day. Today we're going to be looking at the Medgate hospital management system. I'll be taking you through some of the core features of the platform, and I'll be diving you directly onto the application so we could see what's involved in the application. So first of all, just to give you a brief recap, what Medgate is all about. Actually, it's software which offers remote healthcare consultation with for doctors, allowing patients to receive diagnosis and receive the treatment from anywhere with the internet. Um, However, this platform is meant specifically to manage a hospital. So you could use it for a hospital of any size. So I'll just take you through the core features of the application while we're looking at the application in detail. So when you actually head over to the application, you'll see on the left side, we have the dashboard, which actually displays, it displays this page that we're currently seeing, where you can see the income and you could get statistics about the software, and you can scroll down to see calendar of activities for the year. And on the right side here, we find the various type of user roles that are found on the system. So that said, that is what you get as an admin when you log into the platform. You're able to get access to these details. And the first feature that we have, which is listed here, is the billing feature. So when I click on the building feature, what is this feature all about? So this feature is a feature that we created to manage the financial transactions within the hospital. So, for example, if you're visiting, for example, you might want to book an appointment before you arrive at the hospital, and still within, I can say this is the first place where you can start as far as booking appointments at the hospital is concerned. So if you, as a patient, you call the hospital, they will need to start from here to book an appointment with you, and then followed by we have features like the OPD, which is for outpatient, and we also have pathology, and then we have radiology alongside with blood issue and yeah, the blood component. So we've kind of like streamlined everything so that you begin with OPD. If you are an outpatient, you can come directly. But if you are inpatient, of course, you can just start from here. So so we have appointments. So you can book an appointment. But this is just a short way of starting the on starting like by booking an appointment on the platform. So your appointment could come different ways. Then we have the OPD, which I said earlier said is for outpatient, and then we have for IPD is a inpatient, and then we have the pharmacy feature, which is a feature that's designed to handle the pharmacy, and pathology, which is more of the laboratory, and we have radiology alongside with the blood bank, and this is actually where the blood bank for the hospital, everything you need to record it from here alongside with the ambulance. Say if you're booking or if it's a hospital that supports ambulance service, you could actually um, book an ambulance from here and talking from within the hospital. Then we have here a feature which is the front office. This is actually where you get to see how you get to add visitors who come to the hospital. If it's a hospital that actually takes security a high value, you want to be able to record everyone that comes to the hospital. And then you can also record calls that comes to the hospital alongside with emails or mails that comes to the hospital. And you could record complaints that people give to the hospital. Then we have here a birth and death record, which you could actually use it to register any new birth or register any new death that occur in the hospital, alongside with the human resource session, where you can actually add staffs, and then you could see staff attendance and their payroll and their leaves and all stuff. So you get that details from here. Then you could also design something like a duty roster for your staffs by actually imputing their shift and then coming up with a roster and assigning maybe specific staffs to specific time um, on their roster. Then we have here an annual calendar, which you could actually create or add a calendar for the entire year. So every program that's supposed to happen within the year in that hospital, you can keep track on it from the calendar, which has also reminders. And then here we have referrals. So you could add referrals person and also add referral payments. Then we have here the TPA management, which is for third-party insurance companies that you can add directly to the system so that if patient actually visit the hospital and they have insurance from any of the companies that you've added here, they will be able to benefit from the insurance company. And then we have here the finance, which has income and expenses alongside with a messaging feature that is internal, is for internal purpose, which helps it helps you for communication. So you could send a message, you could send an SMS, and you could send email alongside with sending info like credentials for patients to be able to log into the platform. Sorry for that. Then we have here an inventory feature, which this feature gives you the ability to record stocks and add stocks to the system, and you can add tie items and more. And we have also here a download center, which is used specifically by like you could use it, you could upload content alongside, you could share files within the hospital and more. And then we have certificates where you could issue out patient ID, staff ID alongside with certificates um, for the patient, like a medical certificate. Then we have a live consultation feature alongside with report. And there are a good number of reports that you could actually get directly from the system alongside with setup feature. That said, these are the core feature which you can find on the platform. So just looking up here, you can switch language, and here you get notification, and here you can see the bed, like the different words and the bed that is, and from there you can. It's so cool in such a way you can click a bed and see, and you'll be able to add a patient to it directly from here. That is in a case where you want to assign a bed to a patient. And here you have a messaging like an internal chat feature which you could use to communicate between staffs. Then here we have a calendar, so you could actually pop into the calendar and see what's happening alongside with a to-do list. So you could add tasks that probably are in your to-do. Then we have here a feature to see that's for your profile. So that said, that is a brief walkthrough about the Medgate hospital management system. Thank you so much.